Hi James, how are you doing?
I'm good. Yourself?
Good. I'm Latoya. I'm one of the social workers here, and I'll be talking to you about what brought you here today. Okay.
Okay.
All right. So can you tell me more about who referred you?
I guess the court of Wisconsin. I guess.
Wisconsin. Okay. So what happened at the court?
Um, I guess I got another DUI, and it's like my third one, and I guess they wanted me to seek treatment or talk to somebody, but I don't really want to.
Okay. So you're here because the court sent you here.
Basically, it's not my choice to be here. I don't like stuff like this.
Okay. So how many DUIs did you get?
It's my third one.
Okay. So do you think you have a problem with drinking?
Um, Not really. I mean, I think the cops were sitting outside the bar waiting on me and kind of trapped me, I guess, but I don't know.
So you think it was a setup?
I mean, maybe not. I mean, it was late, but I don't know.
Okay. How have this been a problem in the past?
I don't think it has been a problem.
Oh, okay.
I mean, yeah.
But I see that you got your DUI, which is a serious crime, and they must see it as a problem because they referred you to come here to seek help.
Well, that's another thing. I think the court just does that stuff just to get money. I mean, I guess it could be. I mean, it is a crime, but I think they just want money.
Okay, so you just kind of see it as that way.
Yeah, pretty much.
Has this been affecting your life in any other ways?
I mean, I guess I seem a little more aggressive or something towards people, like family and friends and stuff. Sometimes they say stuff about it, but I guess it is a problem. I guess.
So your family been noticing that you've been more aggressive when you drink.
Yeah.
So do you see any problem with that?
I mean, I guess because they always tell me about it. I don't really ever remember doing this stuff.
Okay.
I mean, sometimes I will, but most of the time I don't really remember what happened.
So you think you drink to the point where you kind of don't remember what's going on?
Well, I think it's that, and I mean, maybe, and I mean, I feel good when I do it, but then I mean, I do prescription pills and stuff too, and stuff like that. So I think that might be what makes it worse, I guess.
Okay, so you've been using other stuff as well.
Yeah.
So I'm going to ask you this question, like, what are you trying to get out of coming here? I know the courts referred you here, but what are you trying to get out personally?
I mean, like I said, just to satisfy the courts, I don't have to go to jail.
Okay, so you're only just trying to satisfy the courts. You're not trying to at least make any changes within yourself?
I mean, I probably need to, I guess. Like I said, I don't like talking to people like you or whatever, or psychological stuff, because they just make my head hurt.
Can you tell me more about that? Why don't you like talking to...
I guess I'm just closed and guarded type of person, and I don't even know you, and I don't trust you, so.
Okay.
I mean, why should I have to tell you anything, so to speak?
I understand that, so I see this is just kind of a little different for you, right?
Yeah, a little more than little, but yeah.
Okay. So what are the plans for the courts? I know they want you to change, and what kind of stuff actually have they told you they want you to do?
Basically, I got to seek treatment. I mean, and I don't know. I mean, they just said you got to seek treatment or get treatment, or we're going to put you in jail or whatnot.
Okay. Are you prepared to go to jail?
No. I mean, who wants to go there? I work and I got a wife and 2 kids and stuff like that. I mean, I don't want to lose my family and stuff.
So I see that you're looking at that you don't want to lose your family. You see it is a problem in some way.
I mean, yeah.
Oh.
I guess.
So you say you have a family. What do your wife say?
She obviously, she doesn't like it. I mean, she's scared, something's gonna happen, or I don't know. I mean, they don't like it. So I mean, I guess you're right. I don't know. Maybe I need some help then. I guess.
Oh, okay. So, what is? Can you tell me like what do you want out of, or what's your expectations of treatment? What do you think treatment will be like?
I don't know. I mean, I guess I get clean and sober, but I mean, shouldn't you tell me that? I mean, I don't know. I've never done it.
That's correct. I can tell you more about the treatment process while you're here. If you do get seek treatment, we do admit you. It's different protocols that's going to be followed, whether it's detox. Can you tell me more about the last time you probably used?
Um, see, I guess last. Well, I mean, within a couple days.
Okay. So, I mean, you've still been drinking after the DUI.
Yeah, I got that like a month. The third one I got like a month ago. But you know, I guess it takes a while for you to have to go to court and all that other stuff and whatever. So my lawyer's been telling me that that's kind of what's going to happen, and we're just trying to hit it off before I go to court, like the final court or whatnot.
Oh, okay. So, you just kind of been drinking more because of stress, or
No, it makes me feel good.
so it's a kind of relaxation for you, a coping skill.
I mean, I guess you go. I mean, I guess. I mean, I just I feel good.
Okay. Can you tell me about that feeling? How you said it just makes you feel good?
I mean, I can't describe it. I mean, obviously, you probably don't drink or do drugs, I'm sure, but you wouldn't know. But I mean, it's a good feeling, I guess.
Okay. When do you find yourself drinking more? I know you're going through the courts and everything, so what other times do you find yourself drinking more?
Drinking more as far as what you mean, like when I do it, or
Yeah, when you do it. When do you increase it?
um, I mean, I guess the weekends when I ain't got to work, because I mean, I really don't. That's what's weird. I really don't do it during the week. It's just the weekends, because I mean, I gotta go to work within the weekends. Like it seems like I just go on like a little 2 day binge there.
Oh, okay. So, do that kind of prevent you from spending time with your child? I know you said that you have two kids.
Um, I mean, not really. I mean, like I said, I do it more so like at night. You know, I mean, I'm there at the house doing it. I mean, it's not like I just always leave the house to do it. I'll be at the house doing it. So I mean, they're there. You know, what I mean, but of course they go to sleep. You know, 8, 9 o'clock or whatever, and I stay up to 1, 2 o'clock in the morning. Most times just by myself. Well, I mean, obviously I'm by myself. They asleep.
So they don't see you drinking a lot.
I mean, they do, but then once I mean, like I said, I started probably like 2 o'clock in the afternoon or something, maybe like 11. It just depends. And I mean, they see it, but I mean, you know, they usually sleep. But a lot of times, like I'll be fumbling around or being loud, and they wake up, wonder what I'm still doing up.
All right. So you kind of interrupting their sleep when you do get loud and intoxicated.
I guess you could say that.
No? Do you see the problem there? Like any
Yeah,
problems
I
that
mean,
way?
like I said, I mean, this might sound weird, but talking to you a little bit, I guess I just see that. I mean, I do got issues I need to work on.
All right. So that's kind of good. At least that you're seeing some of the issues that you're looking on, and that's like the positive thing. You're taking ownership that you know you see that that's something that you do need to change. But what about your wife? Tell me more about your wife and how she look at this.
I mean, she doesn't like it, you know. And like I said, I don't really like talking about stuff like this. And you know, I mean, you'd have to ask her that kind of stuff. I don't want to talk about stuff like that. I mean, she doesn't like it. That's all I know. And obviously, I don't want her to lose her and my kids and stuff over this either. So, I mean, she's been somewhat supportive. I mean, she doesn't like it. She doesn't condone it, but I mean, she wants me to get better. I mean, we've been together about 15 years.
Okay. So is that something you might be interested in? Is kind of bring your wife in to these sessions?
Oh, I don't know. That's pretty personal stuff. I mean, if it would help, I just got to talk with her and see.
Okay. You kind of seem a little hesitant about that one. So it's like, why is it personal? You live with her and you're around her a lot,
True, but like I said, I mean, I don't. Like I said, I don't really talk about this stuff, even with her. You know, I don't really like talking. I don't like psychology, a psychiatrist, none of that stuff. I don't like getting, I guess, my inner feelings or something. I mean, even really with her, so to speak, on certain topics, and this is kind of one of them.
Okay. So it's like on one hand, you're trying to, fix the problem that you have, and you know it's a problem where you got the DUI, and it's kind of been a problem in the home, but then you're kind of hesitant about bringing your wife into the picture.
Well, because she doesn't have the problem. I mean, it's me that's got the problem. So I don't understand why she would need to come in. And I mean, number two, I don't want to. I mean, I don't know. I don't know. I'd have to talk with her to see.
Okay. Just to kind of get on the same page.
What do you mean? I mean, so we can get on the same page, or
Yeah.
what? I mean, I just don't think we need you here for that.
Okay.
I mean, to get, I don't, you know what I'm trying to say? I mean, no offense to you and your job or whatever, but I don't think we need your help getting us together.
Okay, I understand that. It's something that's something you don't have to do, but it's just sometimes a suggestion to do. Especially we do family therapy here as well, and if you do have an issue in the home, whether your drink was causing a problem, of course, your DUI brought us here from the court, but it's good to just kind of get the underlying things that's going on to try to see what we could help with.
Again, I mean, I'm here for the court. I don't really care, you know what I'm saying? I'm just doing this to satisfy the court.
Okay, so I understand that you're just only here for the court. So you mentioned that earlier that you were just basically here just for the court and you want to kind of get the treatment. So what treatment specifically are you trying to get from us?
I don't know. Like I said, I don't know nothing about this stuff. I mean, you're asking me what I want help with. I mean, I guess my substance abuse.
Okay, so your substance abuse, that would be priority one, right?
Yeah, I mean, I think that causes everything else kind of ripple effects from that probably. You know, it's hard to kind of see yourself, you know. I mean, what you kind of do when you don't kind of remember stuff. And, of course, you never think bad of yourself or negative of yourself. So, I don't know. But, I mean, I think that's the root to most of the issues I have.
Okay. Have you ever tried to stop this substance abuse before in the past, like on your own, or?
Not really. Like, I've never had no reason. Like I said, I never really felt like it was an issue.
So it was never an issue to you. Just other people see it as an issue.
Yeah, I guess you could say that. But I mean, like I said, the more you talk, I think, I mean, it is an issue, obviously, because like I said, I mean, my wife and my kids and the court, and of course, my parents know about it and stuff like that. So, I mean, obviously, it is an issue. So.
Okay. So I would say, like, some suggestions that we should do is basically just to kind of, I want to set you up with another evaluation to do, and basically just to kind of get an idea, like, more in depth what you're looking for. Like, we have different programs here. We have, like, inpatient. The inpatient could last from, like, 3 to 5 days. I'm not sure if that's something what you're looking for. Or we have the outpatient treatment that basically you go to the program on a 7-day basis from 8 till 12 during the day. So it basically kind of just depends on your lifestyle. Like, I know you work, I know you have family and kids, but it really depends on how serious you think your problem is.
Well, I don't know. I mean, would it be me or would it be y'all that make that decision? I mean, do I need like to come in and get an evaluation, or what? I mean, of course, like I said, I don't know what I need. I mean, this is your more specialty.
This is more voluntary for you because at least, of course, the court referred you here, and they did not basically say what specifically they want. But it would be for you to kind of make that change on what you want to do. So kind of looking at those to see, what best suits your needs.
Okay. I mean, yeah, something. I don't know. I guess set something up and I'll talk to somebody, I guess, an evaluator or something, or see. I mean, I don't know what I need. Like I said, I don't know.
Okay. So, do you want to have any questions about those? More questions about those programs besides that? Like, is there anyone that kind of stand out to you?
Anyone? What do you
Yeah.
mean? What do you mean anyone that stands out to me?
The ones that I basically just
Oh.
explained to you.
Yeah, I mean, I don't know. Whatever's gonna work. I mean, but honestly, do you think an outpatient is gonna work?
Okay. It's really up to you.
That's probably not what I need. I probably need to just go somewhere. You know, be there for a little bit.
And
I don't know about the self-control and all that stuff or whatever it is. I'm not sure. I think the better deal would probably be somewhere where I stay for a couple weeks or whatever.
Okay, so you're looking at thinking residential, like long-term treatment.
No, just 2 weeks or something.
2 weeks.
3 weeks, yeah, like a normal rehab facility or something like that.
Okay. And I have a list of those, so I'll try and set you up with some after this. So if there's any more questions, we could go ahead and end right here.
Yeah, I don't have any more.
Okay. Then I'll have Becky up at the front. She'll basically give you a list of different resources for long-term treatments, okay?
Okay.
All right.
Thank you.